The Withington Alcoholism Treatment Unit was opened in 1974. It was part of an expansion of facilities for alcoholics and problem drinkers in the Manchester region, and was accompanied by the setting up of abstinent hostels, including Newbury, run by Social Services, Lee Bank, Richard's House, run by Turning Point, and also a walk-in centre in Oldham Street, run by the Manchester Council of Alcoholism. In addition, there was a rapid growth of AA. All these facilities were interlinked in the Council on Alcoholism. The history of the units nationally was that they began in the 50s in a hospital in Surrey. Historically, alcoholics had been placed on the wards of mental hospitals, and that was based on the fact that the Department of Health regarded alcoholics as people who drank to cover up their own mental illnesses. Therefore, they should be in a mental hospital under the care of psychiatrists. By the 1970s, there was units in each region in the United Kingdom. In the Northwest region, there was a unit at Lancaster Moor and units in Salford and the Withington unit. Each unit treated both inpatients, outpatients, day patients, and also trained staff, which was an important function of the unit. The Withington unit, therefore, has been continuing since 1974. And this is particularly pleasing as a considerable number of the units established in the 60s and 70s have now been closed down. Thus, the number of units in London has, for example, been dramatically reduced. In the early 80s, there was an addition to the Withington unit, and that was a detoxification centre. This was a part of a research programme, and Withington was one of the units to take people who were detoxifying, particularly from the police or from the A&E departments, who regarded it as a very useful service. After overnight admission and assessment, people could either go home or, if they were dependent on alcohol, move directly into the treatment centre. Unfortunately, eventually, the Department of Health pulled out the funding, and the Regional Health Authority, whilst carrying it on for several years, couldn't continue to fund that, and that facility has never really been replaced. The main treatment of the unit in the early 70s was group therapy, with a whole range of different types of groups, including women-only group, which was at first resisted by the staff, who in fact felt that alcoholism was a problem to both men and women, and you didn't need to separate the groups. However, it was very popular with women, and this group continued. Close links were maintained with AA as they've always been over the period. The number of patients was considerable, and unfortunately people had to wait considerable length of time. The type of treatment facilities which are now available, such as motivational interviewing, cognitive therapy, these were not really known at that time and therefore were not really included. However, the unit now has rapidly expanded and is now carrying out a whole range of treatments, including motivational interviewing, cognitive behavioural therapy, as well as the ordinary standard group therapy sessions. It's very pleasing, therefore, that the unit has continued into this time and remains one of the few units that, once it's been set up, was not closed down. There will always be a need for such a unit, and I hope very much that it will be maintained in the excellent premises we have here. It's important also to consider the training function of the unit. From a psychiatric point of view, the fact that the unit is situated in an undergraduate teaching hospital, that is University Hospital of South Manchester, is very unusual, and is also, of course, linked to the general psychiatric beds or facilities at Withington Hospital, as well as those at the community hospital. A considerable number of junior doctors in their training grades choose to come and train with Dr. Daly to learn about the subject. Even if these trainees are not going to go into psychiatry, let alone deal with alcoholism, and some, or probably half, will become GPs. It's clearly very useful for them to work in a setting where they can see progress and recovery amongst alcoholics. There's also similar training opportunities for nurses and other types of therapists. The sad thing about treating alcoholics is that many of them give a very negative image to doctors, including family doctors. Firstly, they seem to be people who constantly relapse, which of course isn't true. And secondly, they often behave in a difficult way to the GP. And alcoholics and GPs often avoid each other. And there's frequently little contact with the GP, and many alcoholics consider they don't have adequate treatment by their GP. The only way this will be altered is by people undergoing training where they actually see over a period of months recovery. If you're walking on a general psychiatric ward, you tend to see a person who is drunk, intoxicated, with a brief dry out, and then this is repeated, and there is a sort of revolving door. However, if you are able to work in a facility like this as a junior doctor or any other type of doctor, you get a much more positive outlook towards the alcoholic, because you really do see recovery. And working on this unit for many years, our staff have seen many patients make full recoveries and rebuild their lives.